Many healthcare providers still cannot process payments after a cyber attack took out an electronic billing service just last month. That disruption is costing the industry as much as $100 million every day. The attack targeted Change Healthcare, which is part of United Health Group. The American Hospital Association has since called this, quote, the most significant cyber attack on the U.S. healthcare system in American history. Joining us here in Studio 57 is Dr. Céline Gounder. She's the editor-at-large for public health with KFF Health News. And as you should all know by now, she's a CBS News medical contributor. It's a treat to get you here in studio to discuss this massive attack. What makes this suspected attack different, though, from others that we've heard of before? This sounds bigger.
This is by far the biggest ever attack, cybersecurity attack on the American healthcare system ever. This is a system, Change Healthcare, that processes medical payments and touches 1 out of every 3 patients in this country. So it's the magnitude of the scope of this attack is really quite large.
So now what challenges do healthcare providers face? I mean, it sounds like it's just impacting billing, but I imagine that has a knock-on effect in other areas.
Well, this is the issue. It's your ability as a provider to bill. It's also things like prior authorization. So, can you get those medications? Can you get an estimate, say, on a surgery that you want to schedule? What is that going to look like in terms of your insurance coverage and so on? All of those kinds of things are being affected. Patients' ability to fill their prescriptions. At some hospitals in the city here, for example, we're only able to give some patients only 2 weeks of refill. So it means that they may need to come back over and over again. And some patients are even having to pay out of pocket for their refills.
And not everybody has the money out of pocket. Not everybody has the time and resources to get back to the hospital and get your prescriptions as you're trying to deal with your life. So I would imagine people's lives are on the line here. What's the government doing to try and help in the meantime?
Well, the government is trying to create some supports for healthcare systems, not directly supporting patients, but the systems. And this is because without revenue coming in through the billing process, you don't have money to make payroll, to be able to pay your doctors and your nurses and your janitors and all the staff that you need to run a healthcare system. You don't have the money to order the medications or supplies. And so the idea is to try to help support healthcare systems through this, but especially Medicaid providers, those who have less of a buffer, so to speak, financially, they're really in deep trouble here.
You know, I thought that because it's the healthcare system and we have HIPAA laws protecting the spread of information, that it was the most locked down of systems in the country. How then does this attack highlight some of the glaring holes that exist in our medical system?
Well, there are tight controls around patient records, but there are loopholes here. So, for example, it could be something like a medical device that is connected to the hospital's internet, or it could even be an HVAC system. Those provide back doors to enter and hack the internet system of a healthcare system.
Don't click on emails you don't recognize, right? Sometimes it's that simple, and that's how they get in. Dr. Céline Gounder, great to see you. Thanks for being here.